Hello, so this is the ethics final, and this was created by me, Rachel Burton. So, first, we're going to go over what our situation is. In this example, a director of the company requested implementers to provide behavioral services to a consumer with multiple cases of sexual deviancy, harassment, and recorded attraction to children as part of his parole. This individual did not receive any other services outside of his supported living care, and the senior behavior consultant that was currently working with the consumer was not a BCBA. They were an speech language pathologist who had received some behavioral training at a previous job. However, once this provider left, the director asked another implementer, an ABA student, to work with the consumer instead. The implementer did not have training working with sexual offenders and had personal biases that could affect the work. And when this implementer brought this up to the director informed the provider that training could be provided. However, after weeks went by, the training was still not established and the individual was still being seen. So we're going to go over some possible ethical violations. In this instance, we have 5. So the first one that we're going to go over is 1.01, reliance on scientific knowledge, 1.02, boundaries of competence, 1.04, integrity, 1.05, professional and scientific relationships, and 8.01, behavior analytic services. So for the Ethical Code 1.01, reliance on scientific knowledge, it states that behavior analysts rely on professionally derived knowledge based on science and behavior analysis when making scientific or professional judgment in the human service position. So with the situation that we discussed, professionally derived knowledge based on the science behavior analysis couldn't be used in this case because the previous BCBA may or may not have copied FBAs for quite a few individuals and was not being overseen by a BCBA at the time that he was receiving services that were all in all supposed to be behavior analytic. The implementers had no training, and the BCBAs that were available even to ask questions also weren't sure that they had the correct competencies in order to provide services to this individual. However, the director insisted that they come every week. Whenever they were being seen, due to implementers not wanting to make them a more effective predator, they reviewed things that were in his plan, such as cooking for himself, and things that didn't revolve around what his parole stated he needed to receive. And again, going from the 1.02 boundaries of competence, states that all behavior analysts provide services, teach, and conduct research only within the boundaries of their competence, defined as being commensurate with their education, training, and supervised experience. No one on staff had worked with an individual outside of an inpatient facility in the context that this individual was being seen. So no one had the proper training, education, or supervised experience in order to provide an ethical implementation of behavior. One 1.04, this one is about integrity. So it states that behavior analysts do not implement contingencies that would cause others to engage in fraudulent, illegal, or unethical conduct. However, by saying that we were providing behavior analytic services without the supervision face-to-face by a behavior analyst who had the proper training, implementers were being asked essentially to provide both fraudulent and unethical services. It also says that behavior analysts follow through on obligations and contractual and professional commitments with high quality work and refrain from making professional commitments they cannot keep. In this situation, no one on staff had the proper training to provide the services to the individual before they got there. However, they were still put on as a client and was told that they would be able to receive ABA services to help him reintegrate into society after his supported living time was done. If behavior analysts' ethical responsibilities conflict with law or any policy of an organization which they are affiliated, behavior analysts make known their commitment to this code and take steps to resolve the conflict in a responsible manner in accordance with law. So the individual was told that he would be receiving ABA services, and this is a possible violation of this part of the code because instead of being faded off or recommended to someone else, services ended, which was essentially making him break his parole. So not only was he not receiving the help that he needed, he was also forced to break his own parole, which was outside of his fault. The next one that we're going to talk about is 1.05, professional and scientific relationships. So this states that behavior analysts recognize that their personal problems and conflicts may interfere with their effectiveness. Behavior analysts refrain from providing services when their personal circumstances may compromise delivering services to the best of their ability. With a case such as this of sexual deviancy, it is possible to find past survivors of the same type of trauma. When this was brought up to the director, that the implementer had past experiences with sexual predators and had a biased view of how services would go and whether or not they would be effective. Those concerns were brushed aside, and he was told to show up every week without the individual having the proper training or knowledge base in order to really help the individual. The last one that we mention here today is 8.01. So this revolves around behavior analytic services. And it states that behavior analysts do not implement non-behavior analytic interventions, and non-behavior analytic services may only be provided within the context of non-behavior analytic education, formal training, and credentialing. Such services must be clearly distinguished from their behavior analytic practices and BACB certification by using the following disclaimer. And the disclaimer that they use should be placed alongside the names and descriptions of all non-behavior analytic services. So this individual was told multiple times that he was receiving behavior analytic services, not services based in ABA, but behavior analytic services, and that the BCBAs on staff would be overseeing his case. However, one BCBA was only there one day a week, and it was not the day that the individual came in. And so they never had any face-to-face contact with this person, and the BCBA he had worked with before had left the company. And the other full-time BCBA worked mostly with children and stated that his competencies were not covered underneath the sexual deviancy or even the spectrum of adults, that he would require extra training in order for that to be established. However, his caseload was full at the time. So any services provided were not behavior analytic services, even though they were being advertised as such. And that gets us to our second point, is that behavior analysts do not advertise non-behavior analytic services as being behavior analytic. So there are a few options of what could have been done. Suspension of services would be possible. However, that would have had to have been worked out with the parole officer. But if a suspension of services could be done until training was thoroughly completed, that may have been one option. Or a discontinuation of services if the individual shouldn't have been brought on to the company's caseload to begin with, due to it was out of the reach of the competencies of those who were there, then they may have had to discontinue services, possibly helping find an evidence-based program nearby. Whenever we did research, I think the closest thing was an inpatient facility in Farmington. And all the research that was shown did state that an inpatient facility was the best practice to begin with, and then slowly fade out into the community whenever working with cases of sexual deviancy. And the company could have also referred to other service providers that have this training. So, like places in Farmington, or even out of town or out of state facilities, if that's what the individual needed. Some prevention strategies that could have been used and are hopefully being used in the future is training for BCBAs and implementers for the caseload and type of individuals that your company is hoping to serve. Making sure that the BCBA available for the individual and the implementer. If a BCBA isn't able to fit someone into their caseload, then that individual doesn't need to be brought in working with an implementer who is going unsupervised. And making sure to review and adhere to the BACB ethical code. Going down this list, it would be much more evident to see why this individual should not have received services from this particular company at this time. And if they needed them as a client, or if no other options were available, then steps would have needed to be taken before the individual became a client.